Welcome back to Heart with Dr. Raj. Going back to the cholesterol series that seems to be the popular topic in the country, right? How to lower cholesterol, new drugs coming out. So, statins, what do they do? How long have they been around? Guys, they've been around for over 50 years. They are the cornerstone of lowering your LDL cholesterol. We have different types of statins. We have low intensity statins, moderate intensity statins, high intensity statins. We have different doses of all of these statins. We can take statins at different doses, different frequencies. We can do Monday, Wednesday, Friday. We can go every other day. We can go 2 days a week. But we can't stop trying to see what is the maximum tolerated dose of a statin that one can take. A lot of people want to say, don't give me a statin. I don't want to try it. And I have all these, I've heard all these negative things about statins. Well, hold on. Do you actually have a legitimate reason to not take the statin, or do you have a fear of doing that? Cancer patients, right? They get chemotherapy. Does a patient stop taking chemotherapy even though we know there's so many side effects with chemotherapy? It's all about risk versus benefits. So, have that open conversation with your provider about statins. Now, if you're truly statin intolerant, the next option, if you need another 25% further LDL lowering, is go straight to the injectable PCSK9 inhibitor. That is Repatha or Praluent. These injectable, self-administered auto-injectors every 2 weeks, guys, every 2 weeks, and you'll get a 50 to 60% LDL reduction. This is my favorite combination, which is the statin and PCSK9 inhibitor, the injectable, that's been out for over 9 years, 10 years, to get the LDL under 55 for my heart attack and stroke patients. So my very high risk patients who are VHR, very high risk heart disease patients and stroke patients, I really love that combination of statins and PCSK9 inhibitors. That's the injectable. So we'll go over all of these once again. There's different ways to skin a cat, different ways to get your LDL down, but I'm all about efficiency, right? Less is more. So if I can get your LDL to target with 1 or 2 meds, that's better than 3 or 4 meds. So it's all about efficiency and efficacy, and we'll talk more. Thank you.